Welcome everyone to our webinar on the Danish National Strategy on Housing First and the transformation process. My name is Arturo Coelho. I am the current coordinator of the Housing First Europe Hub. And we are beyond excited to have you join us to explore Denmark's innovative approach to addressing homelessness through the Housing First model. Our distinguished speakers today are Elizabeth Høiriis Thorsen and Mette Strunge Dubert, special consultants at the Danish Authority of Social Services and Housing. Both of them have extensive experience in the field of homelessness and have been instrumental in promoting the Housing First approach across Denmark. Elizabeth Høiriis collaborates closely with municipalities and stakeholders to ensure a broader adoption of Housing First. She has developed a digital tool to support its implementation, manages a national partnership of stakeholders. And Mette Strunge also works with municipalities and stakeholders to spread the Housing First approach throughout Denmark. Regarding the Housing First Europe Hub, most of you already know us, but in case some of you don't, we are a network of organizations dedicated to promoting and implementing the Housing First approach across Europe. We provide resources, training, and support to ensure that Housing First principles are applied effectively to combat homelessness. We try to collaborate and to maintain a collaborative platform for sharing best practices, research, and innovation in the field of housing and social services. And actually next week we have the second session of our Train the Trainer, which is our flagship training event in Sweden. So as you can see, we are very active, and during this session Elizabeth and Mette will discuss the Danish social system, the progress and the challenges in reducing homelessness, and the new political agreement focused on Housing First. So I will ask you, the audience, to be active, proactively asking questions through the Q&A box at the bottom of your screen, because after the presentation we will have this questions and answers session, providing the opportunity for you to ask questions and exchange insights with our speakers. Let me remind you some rules. Please mute your microphones during the presentation. You can use the chat function to share your name and where you're from and the organization you work for. And lately, the last thing is just be respectful when you ask questions and concise as well, to keep to have time for every question that you might have. Yeah, just one more thing. If you want to visit our websites, you can get more information and more resources, and also check out our YouTube channel, where we always put our webinars, selecting some highlights from them for you. So thank you again for joining us. And without further ado, please welcome Elizabeth Høiriis and Mette Strunge. The floor is yours.
Thank you very much. I will share the slides and then I will start my presentation. Hello everyone, my name is Mette. And Arturo, can you see the right? Yes, I can. I think it's fine.
Yes,
now.
Perfect.
Yes. Hello everybody. We have been looking forward to this webinar and to tell you about the National Homelessness Strategy in Denmark. As Arturo said, we will hold our presentation, and then Elizabeth and I will answer any questions you may have as best as we can. And Arturo had said what our agenda is. It's about the social system in Denmark, what numbers there are, and situations, and a short historical view, and what challenges we see in Denmark. And then Elizabeth will tell you about the new strategy. And at the end of the speech, I will shortly tell you about our counseling to municipalities and homelessness shelters to support further implementation of Housing First. Here you can see our little country. We have in the start I will tell you about a little bit about the social system in Denmark to offer counseling and support as to prevent social problems and to offer a range general services which may also serve a preventive purpose. We have a tax finance and not insurance-based system. We have equal access to services generally independent of labor market status, nationalities, and income. And the Act on Social Services is a regulative framework when it comes to local support and help to different groups with special needs. This means that the 98 Danish municipalities plays a key role in delivering the social services. This including offering temporary accommodation to people living in homelessness and also referring them to the public housing with the social support they need. And here you can see the slide is showing the numbers of homelessness citizens that have been registered during the mapping from 2009 to 2022. And in the fall, we will have new numbers for 2024. In the week of counting this in 2022, 5,789 people out of a population of 6 million live in homelessness. For the first time, a significant decrease since 2009. These counts provide us with knowledge of both scope and social profile of homelessness. Data also give us knowledge about different age groups as well as physical and mental illness among our homelessness population. We also collect data about the use of temporary housings and shelters in Denmark, and the average length of staying in shelters has increased from 113 to 122 overnights since 2015. So altogether, we have a solid knowledge of how social problems and living in homelessness are often independent and must be tackled with a holistic approach. And then these numbers, we have the numbers you see in the slide is for 1 week for that year. And from research, we know that to see the real number of people in homelessness over the course of a year, we need to multiply by 2.5. This gives a number of approximately 14,500 people out of a population of 6 million, who at some point during a year is in a homelessness situation. Here you can see in this slide the development of various homelessness situations. The largest category is the gray one, which is homeless shelters. Homeless, as the figure shows, the share has grown since 2019. In this category, we can also see in the mapping that there is an increase in people in long-term homelessness, where the efforts in relation to young people have meant that we have seen a decrease here. We try to avoid that young people stay on homelessness shelters, and that we have trying to do in our preventing initiatives. And here you can see the second largest category, the dark blue, is overnight stays with families and friends who are often young people and has become smaller. Again, the efforts on youth interventions that have given results. And in this light blue category, we have rough sleepers, has also become smaller. And maybe it's both, maybe because the corona, we went more on the streets with the street plane employees, but it has almost been in the same numbers over the years, as you can see, as the other categories has also been unchanged over the years. And on this slide, you can see how many of the people who were counted in the homelessness mapping from the previous slides. In the first column, you can see mental illness. We have an average about 62% of people in the homeless category has mental illness problems, and 66% have substance use, and people who are challenged by both are 42%. And if you see on the right, it's the street and rough sleepers who have the highest numbers. In addition to mental illness and abuse, many people in homelessness in Denmark have many other challenges: trauma, psychological and physical nature, no education, a hard upbringing, being placed as a child, and so on. And being in a homelessness situation is traumatic in itself. But I think all you guys, you know all this. It's maybe the same in your countries. Here, before we go later on in the presentation to talk about changes in Denmark, we have included this slide, which explains what appears from the Social Service Act in Denmark in relation to shelters. And I will now read up. The municipal council shall offer temporary accommodation and facilities to persons with special social problems who either have no home or are not unable to stay in their own home, who need an acute accommodation facilities and offers activating support, care, and subsequent assistance. Only the manager can register a citizen at the shelter if they are within the target group. In Denmark, every citizen has a case manager in the municipality with their registration number. It is not the same as the case manager in the Housing First methods. They are solely responsibility for the holistic case management by an action plan before the citizens enter housing and get social support. On this slides, I will talk about the historical view on the transition to Housing First in Denmark. We'll do it very quick so you can hear about the new strategy. But we started in 2009 with a method testing of Housing First in a Danish context. The method showed good results. For every 10 persons in homelessness who received an intervention based on Housing First, approximately 8 to 9 managed to get out of the homelessness situation. And further research also showed that there is a positive overall socio-economic benefit in implementing Housing First, where the investment gives a positive outcome within 1 or 2 years. These results came from working with the different methods within the Housing First approach: critical time intervention, intensive care management, and assertive community treatment. The following years has been the focus has been on implementing of Housing First to more municipalities, and it is a responsibility of local governments to refer the citizens to both public housing and to decide on the levels of support. And in the following years, the further implementation have been based on best practice and state-driven guidance. And from 21, a new political agreement is transforming the area significantly, and Elizabeth will tell you more about that in a short time. Before Elizabeth goes on, I will tell you about the challenges we have in Denmark that led to the political agreement. As I told, we have a lot of data on the area of homelessness. These data are showing some of the challenges that led to the political agreement in 21. As also mentions, the average length of a stay is increased over a longer period of time. A big part of the group of people, about 70%, staying in shelters are ready to move, and we know that from research, but the relevant housing is lacking. There is still a potential to further implement Housing First, as other research shows that only approximately 8% of the target group in Denmark is met by Housing First method. As I also explained earlier, this group is experiencing complex problems and need a holistic approach in the intervention. There is also a potential to implement what we call an action plan to more of the target group to support the holistic focus in the interventions. And now I give the word to Elizabeth.
Yes. I will now tell you more about the political agreements. The ambition of the political agreement from 2021 is to reduce the number of citizens in homelessness significantly. As Mette showed earlier, in the recent count of homelessness, we have seen a decrease in the number of people experiencing homelessness. The ambition with the political agreement is a further reduction without being able to say a specific target. For a long period of time, we have also seen an increase in the average length of stays in shelters for homeless people. And the ambition of the political agreement is also to end long-term homelessness. We go to the next one. The political agreement is based on input from all relevant stakeholders in the field of homelessness, and also input from a group of political experts from different ministries, the social, the housing ministry, Ministry of Finance and Justice. And here I give you an overview of the 3 focal points in the agreement on how to achieve the ambitions just mentioned before. I will explain each of the focal points afterwards, so this is just to make an overview to you. Firstly, there must be affordable housing for people experiencing homelessness and also people in risk of homelessness. And within this lies a focus also on the preventive measures. Secondly, we look into a change of the economic incentive structures due to a change in the state reimbursement to municipalities for the cost of stays in homeless shelters. And thirdly, the political agreement contains also various initiatives to support the full implementation of Housing First. So based on these 3 focal points, the political agreement is changing the homelessness area in Denmark significantly. Some of the changes have even required a change in the law. So now I'll take a look into how to get more affordable housing. Yes, in the next one. Yes. To understand the changes in regard to getting more affordable housing, I will start giving you a quick background information. Social housing is a part of the Danish welfare system. It is non-profit, and its main purpose is to deliver affordable housing for all in need, including people experiencing homelessness. 20% of the housing stock in Denmark is non-profit housing. Within the social housing stock, you find different types of housing at different sizes and different costs, and especially the smallest and cheapest social housing that costs around 470 euros per month are relevant to people having experienced homelessness. In Denmark, municipalities play a key role in addressing homelessness through, among other things, the allocation of public housing. A key aspect of this effort is the policy allowing municipalities to refer every 4th public housing units to individuals in needs, for example, people experiencing homelessness. This initiative ensures that a significant portion of available housing is dedicated to those in urgent need and facilitating quicker access to stable and permanent housing. However, the municipalities are not using this possibility to a maximum for different reasons. Only 11% of the cheapest vacant non-profit homes are referred to urgent social housing tasks. And next slide. Thank you. So I will now tell you more about the initiatives to get more affordable housing following the political agreement. This includes how to use the existing housing stock and also how to build new housing units in Denmark. So regarding the existing housing stock, the municipalities have different possibilities. This includes a focus on intensifying the municipal efforts in allocating public housing to homeless people, as just mentioned before. For example, by providing more data on this area to the municipalities. Another new possibility is to provide a temporary financial reduction to a maximum of 1,800 already existing apartments. And this is very helpful to many municipalities that are experiencing a decreasing supply of the smallest and cheapest social housing due to renovation of housing and as a consequence of that, the increased prices. And lastly, a new change has been made to expand an already existing housing model. Translated from Danish, we call it transition housing. And this model is also about rent reduction and provide the municipalities a possibility to reduce rent for 5 years before it was 2 years for people that are moving from shelters and temporary accommodation to more permanent housing. So these were different ways to use the existing non-profit housing stock for the target group. I have only talked about non-profit housing now, but private housing is also a possibility, and is getting more used also for this target group. And the other thing that I'm describing in this slide is that the new political agreement is also supporting the construction of new housing units to this target group. Could you take to the next slide? Yes, so now I move on to the second focal point, the rearrangement of the economic incentive structure. The economic incentive structure has changed. The changes affect both how the municipalities and how the homeless shelters work. Basically, you can say that the changes means that funds spent on shelters should be canalized into a housing first intervention. And this is done in the two ways, very simply as described here on this slide. So firstly, a reduction in the state reimbursement. The old reimbursement model consisted of a reimbursement to the municipalities covering 50% of the costs for an unlimited period of time. This has been changed with the political agreement and a law change so that the municipalities only receive a reimbursement for a limited period of time, and that is 120 days. After that, they receive 0% reimbursement. This rearrangement of the existing model will strengthen the initiatives for the municipalities to more quickly accommodate homeless people in permanent housing. The law does not make it illegal or impossible for the target group to have longer stays in homeless shelters, but the change is regarding the financial impact on municipalities for the longer stays. The other part that I describe here regards the preventive measures when introducing a new paragraph in the Act of Social Services. The new paragraph supports the increased use of the evidence-based methods within the housing first approach, helping more people out of homelessness. So to encourage the increased use of this new paragraph and also the increased use of the housing first methods, the municipalities are getting a 50% state reimbursement to cover the costs for up to 2 years regarding the support in housing for the people coming from shelters and moving to permanent housing. So this state reimbursement only regards people following a stay in a homeless shelter. And the next, thank you. So now I will move on to the third focal point regarding some of the initiatives to support the full implementation of Housing First. A big change to this area is that the municipalities can now discharge a person from a homeless shelter on these 3 conditions. The person has an action plan, the municipalities has allocated permanent housing to this person, and also social support and housing for this person. Before, it was based on a decision from only the principal from the homeless shelter to discharge a person from a shelter. So by introducing this possibility to the municipalities to discharge people from homeless shelters, this can support the municipalities in how to quickly help people to get out of the shelters and into permanent housing. The action plan is a tool to ensure a holistic focus across the different interventions that the target group receive. And a new requirement in the law following the political agreement is to make the action plan mandatory for all people having stayed at a homeless shelter, because we know that they have complex needs that need to be addressed in a holistic, with a holistic focus. So the consequence of the overall ambition to reduce the number of homeless citizens significantly and also to end long-term homelessness is that in the future, we expect to see, among other things, a downscaling of shelter use. And lastly, I will tell you about our national partnership. The national partnership has been established to follow the transitioning process following the political agreement. It involves a wide range of stakeholders, including representatives from municipalities, non-profit organizations, housing associations, research institutes, foundations, and ministries. We meet twice a year, and we had a meeting actually yesterday. All of the representatives in the partnership are focused on the implementation of Housing First and can bring in perspectives from the different organizational backgrounds and perspectives that they represent. In the partnership, there's a focus on data-driven decision-making. They share their experiences, and through annual reports, the partnership gives feedback to the political level on the transitioning process. And we have just this week published the annual report from 2023. Yes, and now back to you, Mette.
Thank you, Elizabeth. I will tell you, this is our last slide, and I will tell you about, actually, Elizabeth and I is working with this thing. It's how the spread of Housing First through advising municipalities and homelessness shelters. We help both, as it says, municipalities and homelessness shelters with guidance. And as you can see, that our advisory function contains 3 tracks. Individual counseling, that's about 1.5 years, where we go out and have a close cooperation with the municipalities or the housing shelters and the homelessness shelters. And we can also have a group-based counseling for 6 months, where we put different kinds of municipalities together, different kinds of homelessness shelters, so they can learn from each other what they want to be better to do. It could be how to use the action plan, and it could be how to collaborate in the municipality with the different wards and etc. And then there's general counseling. It's we can have a presentation of what is Housing First and talk about what is good to do and so on. And that could be for 1 day or 2 days. And a part of our advisory function is that we offer different courses in Housing First and documentation system. And when we offer it, it is free. It's a free thing to maintain, and there can be other courses in Denmark where you have to give a fee, where it's maybe private people who offers the courses. And then we, as Elizabeth said, we have also this digital based system, the documentation system, that is where we want to collect data so we can support the municipalities to see when they use the Housing First measures, how they work, what do the citizens say, and how they the results over some period of time. And it can help to give the politicians and the municipalities better knowledge on which to make decisions. Yes, that was our presentation from Elizabeth and I. And maybe you could, I was thinking when we had the presentation, what is difficult in the new strategy? And of course, things are difficult, especially, one example is that the reimbursement goes when you go from a homelessness shelter to your own house, and when you can have the reimbursement for the social support, you have to have stayed in a homelessness shelter. But if you're a rough sleeper or go from family and friends, you can't have that reimbursement. But the partnership is following that. What problems do we see? Yes, and we also see that it puts press on the municipalities to act more quickly, because the days of there's only 90 days, 120 days of reimbursement, and then they have to act more quickly. But everyone wants to go the same way. Everyone says this is the right way to do. If you are a citizen, you are a municipality, or you are a homelessness shelter, so that is very that is very good. Yeah, for the implementation, you can say that. But yes, that was just another word on our presentation. So Arturo, back to you. Should I take the presentation off?
Yes, please. Yeah. Well, thanks a lot, Elizabeth and Mette, for having shared with us that presentation. I think it's a great topic. For sure, a webinar of less than 1 hour is not enough to go through all the questions we have. But yeah, it's now time to open the questions and answers moment. We always like to ask the audience to engage in a dialogue. So please feel free to ask all the questions you want to make to Elizabeth and Mette through our Q&A box at the bottom of your screen. And we already have one question, but while we give people some time to make more questions, I would like to ask you a question about the coordination, because in other countries across Europe, and for example Spain, coordinating between systems in the same country in order to address homelessness can be a challenge. So I wanted to ask if that's the case in Denmark, if you have to collaborate with other systems in order to address homelessness, and how is that? How is it working?
Yes, that is also a challenge in Denmark. And within municipalities, then we can coordinate and be better to work together, to have a more view on each other's working area, to what can I do to prevent homelessness. For example, when if you're unemployment, so if you are there to talk with the case manager, then she looks on where are you going to stay the next night, so have a better view in the municipalities, in the engine machine, as we call it. But if we are talking about the psychiatry system, so that is a all different system, they are also under pressure in Denmark. We are aware that in order to help this target group, they must focus to be on the coordination, and we want to coordinate both in the psychiatry system and in the social system, and we try to have initiatives that focus on the coordination. But it is difficult, but we are trying all the time to be better, and it's so essential, because the complex problems, as the slide we showed you, is a high range of people who have psychiatric problems and abuse problems. So we have to coordinate. So we have an agreement of we want to do that, but it is a challenge and it is difficult. So we hope that the assertive community treatment methods will be more used in Denmark, where we can both be better to collaborate. They have the same method in the psychiatry system with the flexible assertive community treatment, and maybe we should be more focused on mix the methods we have in the municipalities and mix the methods in the psychiatry system. But it's an ongoing challenge, I will say. Yeah.
I can imagine. Yeah. Thank you, Mette.
And I can maybe add to your question about the coordination between different areas. One of the problems for this target group is that they lack housing, a place to live. So they need both the social support and the housing support. And it is very new in Denmark that we now at the political level have a minister for both the social and the political level being the same person. And this helps a lot in the coordination at political level. And it also helps when we talk to the municipalities and say, it is very important that you collaborate between the social intervention and the housing solution that you offer to this target group in order to make good results with this target group and helping them out of homelessness.
Thank you, Elizabeth. So we have already 4 questions. So I would like to ask you, Elizabeth and Mette, to keep it concise in order to try to answer all of them. So the first question is by Natalie Van Schagen. You can find the questions on the Q&A section. So the first question by Natalie is, in the times of homelessness, there is big overlap with ethos-like definition of homelessness. Is this the definition that is used? How was homelessness counted in the several years? In one point of time, like the ethos-like counting, or collected data over a period of time? How do you count people sleeping in different places, couches or family cars, holiday parks, etc.? And how did you get to multiplying by 2 times 0.5 to get to a more accurate number of homeless people in Denmark?
Should I answer, Mette? I can give it a first try. We do the focal one point of time counting. So in 1 week, week 6, for every twice a year, we ask the municipalities to count all the people in homelessness that they meet or they know about. Also, the shelters count the people that they know about in that week. So for the big national countings, it's the one point of time calculation method that we use. But in addition to that, for all the shelters, they do a national registration. So they send in data on all the people that they that overnight on the national in the homeless shelters. So we also have statistics for every year about the shelter use. So when we combine the difference between who are the people in the point of time calculation counts and the people in the national statistics for over a year, one of the big research companies in Denmark have found out that there is a multiplying factor between these two counts, so that we can estimate. It's only an estimate because we cannot be completely sure. But if we calculate, multiply by 2.5, we can estimate how many people in total for a year are in a homelessness situation. So it is just an estimate.
Thank you for answering that question, Elizabeth. So we have a second question by Jens Ostergaard. Do you have any studies on the cost benefit of housing first? For example, prevention of mental illness care because of less anxiety and fear of the future, and has been reported from Finland. So is there any study about the economics of housing first, if it's worth it because you save money from avoiding people to go because they don't need to go to the hospital or etc.
We have very early evaluations of from the method testing showing that housing first works here in Denmark. We get good results. So we have, from an early time, we have made many evaluations of this area. And in addition to that, this week, one of our big research companies has also published a new report showing what are for the target group, what kind of intervention do they receive from the social system, from all of the other systems, also the psychiatric system, hospitals, if they're in prison. So we have data from the whole group, and this showing that it is important that we work together in order to reduce this impact on the socio-economic and also due to all of the individuals not getting the right intervention. It's important to increase the use of housing first. Have you anything to add, Mette, on that?
No, it's always very important to I can see because of less anxiety and fear of the future. It's very important to measure as well, and we do that in our projects. But I can't resuscitate anything right now. Maybe we can write something about it. I don't know. But do you know anything there, Elizabeth? I think in every study we will follow those things to thrive and to feel better and have recovery and so on. But I think the question also was about the cost benefit. It's I don't think I can answer more more about it.
All right.
We have lots of
Thank you.
data on the area that we try to use in different ways. So we try to make data-driven decisions in
Yes.
this area
Yeah.
in
Yeah.
the municipalities and also on political level. I think that's, yeah.
Thank you, Elizabeth. We have more questions, so I will need to ask you to keep it very short, the answers. So Peter Dahl is asking what kind of evaluation is used to follow up or monitor the strategy, and how do you try to impact the political decision makers locally?
We use registered, what do we call it? We use the national statistics to follow up.
Yeah.
We have selected different focal points that are important to monitor in order to see if we get the right effect out of this the strategy. So national statistics and
we have a task force as well in our workplace, and that is very local with the local municipalities. We go and have for 2 years we work with data as well, and with the documents they do, and with interviews of all people who work with homelessness people. We have seven municipalities we work in that kind of way.
And when we work with a municipality, we also introduce this documentation system so that they get local data, and this local data on how they work with the target group locally. And this data, we try to see if they can, or we try to encourage them to use the data whenever they talk to the political decision makers locally.
We have a question from Ben Ricky from Paris about immigration, or the lack of effective integration of migrants is almost certainly the primary driver of increases in homelessness in France over the past 20 years. So Ben wants to know what's the situation in Denmark about immigration.
I don't know so much about that. It's not. I don't think it's the same situation as in France, but we also see some migrants who also are homeless. But we also have this register system. So if we can't count anyone who doesn't have this register number. So I can't say anything more to that. What about you, Elizabeth?
No, that's already useful to know. So you don't count anyone who doesn't have a registration number. Right? Okay.
Or the registration number is needed in order to be in contact with the municipalities. So in that way, the municipalities, they don't know about all of the people that may live there.
Yeah. Okay. So Tamara Kushel says that in the Netherlands, they make a distinction between homeless people with psychiatric problems and substance abuse can get into shelters, and then homeless people who are viewed as self-reliant, not right to get access to shelter. Do you make this distinction in Denmark too, where people can go or not go to shelters due to the psychiatric problems or substance abuse?
No, we don't do that. The target group is if you have a social problem, you're without housing, and you have complex problems. But then again, we hope that the people who have the psychiatry problems can get help in the psychiatry system, because it's better for them. Because the homelessness shelters is there for the group who is very serious, complex social problems, and more have very severe psychiatry problems. So that is, again, we have to coordinate, we have to work with the psychiatry system. So we don't say no to them, but we try to help them to go to the places where they can have a better help, and then we take care of the housing, to get to the houses and to have the social support, and then coordinate from there. But we don't say no if they're within the target group.
Thank you, Mette. We have 2 more questions, and these will be the last 2 ones. So we have a student of architecture from the University of Ljubljana, Oscar Dibiak, asking about the buildings. The buildings that contain many apartments for the program Are they creating ghettos? Is there a stigma going on there? Are there any other cases instead of having a whole building for the problem is more scattered housing? What do you want to say about it?
I can start. We are trying to be very good to have the social support going to where you're going in the housing, and have a very close collaboration with the managers of the who have the houses, who have the housing, so they can. We have the collaboration where they can phone to the municipalities and say, I think they need more support here, and so they know that the social system is there. I don't think I explained me so well, but maybe some places you can see there is a more group of people who are coming from a homelessness shelter, but we're trying overall in Denmark to have a variety of people who's living in the different places in Denmark. So we are very we look at that, and we try to mix people, so we have a various group of people, and have the needed support so that they can have a real home and have a good life with the neighbors and so on.
Thank you, Mette. And the last question comes from Tamara Kuschel again. How did you get the Department of Housing, Justice and Economy to be part of this political agreement? Because in the Netherlands, combating homelessness gets support mostly only in the social domain.
It has been a long process. We started in 2009, as Mette told, with only focusing on housing first and the homelessness challenge from a social point of view. But we could see in many evaluations that the problem was that there was not enough housing. So after like 10 years, this early collaboration started between the social and the housing, yes, on a political level. And before we got the political agreement, there was a lot of meeting, there was a lot of discussion in order to find out what do we want to get a solution that everybody could agree on. So I think the short answer is it has been a long process.
Yes, and we also
where we are now.
Yeah, and we also looked to Norway and Finland before we had a paper about that to see what did they do, and they did some of those things.
Okay, so thank you very much, Elizabeth and Mette, for answering all these questions. I think it was one of the most engaging webinars so far for us, for the Housing First Europe Hub. I have to congratulate you for all the work you're doing down there in Denmark. It's impressive, and hopefully the future gets even better in the fight against homelessness. So thank you very much for your presence today, and thank you as well for to the audience for being so proactively and engaged with the topics. You can find this webinar in the following weeks in our YouTube channel. You will find the whole webinar, but also a couple of short videos with the highlights of the presentation from Elizabeth and Mette. So feel free to visit our YouTube channel, our website, and I wish you all a very nice weekend. Take care and see you soon.